So I'm Jessica Armitage. I'm a PhD student based at the School of Psychology at the University of Bristol. And today I'm just going to talk briefly about my experiences of using longitudinal data to further our understanding of positive mental health and resilience. So the main data set that I work with is called the Avon Longitudinal Study of Parents and Children, or ALSPAC. It's also referred to as the Children of the 90s. And just briefly, it's a birth cohort study that aims to understand how genetic and environmental characteristics influence health and development. So the study began about 30 years ago, and they recruited about 14,000 pregnant women, all from the Bristol Avon area. And they've since followed the mothers, their partners, and their children annually every year. And they've collected a range of different measures, including sort of genetic, biological, psychological, social, and a range of other environmental exposures. And this has allowed us to study all of these in relation to health, social, and developmental outcomes. And this is one of the key reasons that I've personally decided to use this study. So because it has such a wealth of data, it's allowed me to study some really complex relationships, so looking at the interplay between genes and environments. And it's also allowed me to control for a huge range of confounders, which is especially important in my area of research in epidemiology, when we're sort of studying for causal relations. So to access the data, the vast majority of it is available for immediate use on request. And this is done by submitting a research proposal. And within this, you state the variables that you'd like to access. And these can be found online. There's a free resource where you can search the variables. You can also have a look through the range of questionnaires that have been given to participants. But I'd say one of the best ways to get a feel for the data set is to talk to people that have experienced using the data set. So to find these sort of people, you can read papers, you can search the ALSPAC proposals, which is also freely available online. And just looking at the co-authors of papers and getting an idea of who's working with the data set is a really good way of understanding the variables that the data set has. So just to give you a bit of a flavour of the sort of research that ALSPAC has allowed me to do, this is a study that was published this year by myself, and it was a longitudinal study that looked at the relationship between peer victimization during adolescence and its impact on well-being in adulthood. So peer victimization is just bullying, so people that have been victimized as a result of bullying. And by using the ALSPAC data, I was able to study this over a 10-year period using the same cohort of participants. So I had data that started at the age of 13, and we also had data about their mental health at age 23. There was also a huge range of confounders that we included in the study. So we included some sort of emotional problems in childhood and some socioeconomic factors, as well as their depression and other factors across the 10-year period. So this allowed us to really test how sort of early problems early on sort of unfold and predict outcomes later on. And doing so allowed me to understand a bit more about resilience. And this was a really key finding of the study, was that many people who were victimized in adolescence, although they may not go on to be depressed, they still suffer in terms of their well-being. And this was a really key finding in the literature, and it allowed me to go on to write for the conversation. And I think without access to this really comprehensive data set, I wouldn't have been able to sort of have such a key finding because it was based on so many participants and I had all these confounders. So my top tips for using secondary data would be to have a really clear analysis plan. It's really easy when you have this huge wealth of data to get a bit carried away and a bit excited and have so many different options. But this can sometimes lead to sort of, not very ethical research practices, so to speak. And in research, the whole aim is to be as open and transparent as we can. And this can be difficult using secondary data But this is a really nice paper here where they talk about some of these challenges and different solutions to this.